A very good afternoon to everyone. This is Panchai here with you. We are live from Prime Health Facebook page and our YouTube channel. A very welcome to all our viewers. An important topic today here we have for today's webinar is about the dry eyes. A lot of people have this issue which they are looking forward to get a treatment for, or how they can definitely look into this. What is actually dry eyes? Dry eye syndrome, and how do we diagnose it? What is the treatment on this? All of this information will be given to you today by one and only. We have Dr. Sumeet here with us today, who's the specialist ophthalmologist at Prime Medical Center, Alnahda, Sharjah. Dr. Sumeet has an extensive experience of 21 years, out of which he has been practicing in UAE for the last 10 years. Doctor, thank you very much for joining us today.
Thank you.
So before moving ahead, I would like to tell everyone that we will be asking questions to Dr. Sumeet once his initial, talk over the topic is done. We have a few questions that have come earlier, pre-session, and we are going to ask all those questions to Doctor also. If you have any questions related to dry eyes, which you think that this is the right time to ask the doctor will be more than happy to answer all your questions live. So please, for the next 30 to 35 minutes, this is going to be an important topic, so stay tuned with us. Dr. Sumeet, without further delays, I would really like to hand it over to you on this very important topic of dry eyes, please.
Hello and a very good afternoon to all. So first of all, I really appreciate the investment of time and interest that my audience has today shown to us. So we will also try from our level best that the program turns out to be very informative to you. So first of all, me and my team have deliberately chosen this topic of dry eyes because this is of a universal appeal. As you know, millions and millions of people are affected by this dry eyes. Me, you, and all practically are affected to this to an extent. So you will be surprised to know that the global incidence of dry eyes ranges from 10 to 50%. And in the Middle East, the incidence reaches at around 50 to 60%. In a recent study done in Dubai, the incidence of dry eyes was calculated to be as high as 62%, which is mind-boggling. Now, one recent thing that I'm seeing in the last few years, me and all my colleagues that we discuss is the increased incidence of dry eyes in children. Because what is happening is in the last 2 years, because of the COVID thing, most of the children are being forced to stay at home in front of the screens for hours doing their school exercises and school teaching. So this has spiked the rate of incidence of dry eyes to an enormous extent. So now we are seeing children as young as 10 years, 8 years, having profound dry eyes, very clear-cut dry eyes. So this is a matter of concern, but fortunately, dry eyes is not a very serious concern and can be tackled very easily. So now I would like to ask Mr. Fahad if he has any questions for me. So we'll like to make this session more informative and interesting by question-answer sessions, rather than me talking all the time.
Absolutely. Thank you very much, Doctor. So we've got a lot of questions here, Doctor, that I really want you to answer. And of course, in the meantime, as I mentioned earlier, that we would like our audience to please go ahead and ask questions so that we would, Doctor would answer to all your questions. Doctor, dry eye syndrome. What is actually dry eye syndrome? If you can just give us a short brief on this.
Yes. Now, if you see, most of the people and the patient, they feel that dry eye means the tears are not sufficient enough. While this is partially true, this is not wholly true. Because, dry eye now the definition of dry eye now consists of a whole myriad of symptoms. Like, for example, of course, having less tears, then having poor quality tears as well. You may have sufficient amount of tears, but the quality of tears is not good. Like, for example, now the tears consist of oil, water, and mucus. Now, it's just like making a tea. Now, if we make tea and the ingredients like tea leaves, milk, and sugar are not in proper quantity, the whole tea gets spoiled. So similarly, the quality of tears is very important. So that means that all the constituents of a tear like oil, mucus, and water have to be exactly in the same constituent as they should be in the same ratio. The second is the patient should have some symptoms as well. Because of this, the patient should have blurriness, he should have some problem in the cornea and some burning, blurring effects. So all this, then the other thing that is important is inflammation. So inflammation, poor quality tears, poor quantity of tears, and symptoms. These constitute what is called as a dry eye disease or a dry eye syndrome. If you see, it is no more called just a plain dry eye. It is called a dry eye syndrome because it has a gamut of manifestations.
Perfect. Thank you, doctor. What are the symptoms of dry eye? How you would know that we've got dry eye?
Well, there are again lots of symptoms. Different people have different symptoms, but most common would be, redness, itching, blurring, foreign body sensations, grittiness. You feel there is, the patients complain that always I feel there's some sand inside the eye. And if the symptoms advance, you may have sensitivity to light, and you can also have persistent blurring in the eye. So these are the signs of advanced dry eyes.
Dry eyes. Okay, great. I've got a question here from Mr. Sayyid Ghulam Faisal, and he's asking, doctor, can we use drops other than Ganfort? Pardon me if I pronounce it wrong. If we have glaucoma patient.
Yes, of course. See, this topic is not directly related to glaucoma, but Ganfort is just one of the many glaucoma anti-glaucoma agents. There are 3 or 4 more other which can be used. So it's not the only medicine for glaucoma.
Perfect. Thank you. Thank you very much, doctor. Doctor, how is dry eye syndrome diagnosed?
Well, the diagnosis is pretty simple, and it is done most of the time. It can be done in just the clinical settings. A patient comes to us. The moment we flash a light on his eyes by a slit lamp, we can very well see that he has symptoms. He has signs of dry eyes. But it can be confirmed mainly by some strips that we put, some coloring agents we put in the eye, and in few seconds we can see that the patient has dry eyes. These tests are painless. However, now if we feel the disease is more severe, or there is some generalized disease associated with it, like rheumatoid arthritis, there are some more sophisticated tests which we have in our hospital and the centers as well, which are pretty easy and painless as well.
Great, thank you. Doctor, I've got a question here from Dr. Asia. One of my patients complained of difficulty in reading, but all the tests are normal. Any suggestions?
Yeah, well, the thing is that most likely if the patient is above 40 years of age, he should check for his glasses, because this condition is called presbyopia, and people above 40 years frequently suffer from it. So for sure, but if the patient is younger, then he needs to do some more tests.
Okay, great. Thank you. I hope that answers the question to Dr. Asia. Doctor, coming back to another question that I really have here with me. What complications could arise if I leave eye dryness untreated?
Well, the complications are not very severe, but definitely they will increase the discomfort in your eyes. So the general discomfort, which is so characteristic of dry eyes, will increase. And as I said, if it goes unchecked, you can have some ocular surface problem. That means some corneal problems. So once the cornea starts getting affected, it can affect your vision, your eyesight, and cause you some lot of discomfort.
Perfect. That's great. Doctor, moving on towards another question that I have here. What lifestyle changes, such as nutritional supplements, smoking cessation, may be helpful?
Well, actually, there are some lifestyle changes definitely. Now, if we see, the most lifestyle change would be, our behavior with the screens. So now if you see, most of us, whether it's the adults or the children, we are in front of screens, either due to our jobs or due to kids, if kind of the lifestyle they have. So the first is to restrict. If you have children at home, to restrict their viewing. So 3 to 4 hours, more than 3 to 4 hours of screen time is not allowed for pediatric patients below 12 years of age, as per the recommendations. What we can do as adults, if we are in a job which involves lots of watching in the computers, that after every so the rule of 20-20 has to be followed. That means after 20 minutes of work, try to gaze 20 seconds in a far away distance just to relax the eyes, and then you have to put eye drops as well. And the one more thing that you can do is the nutritional supplements like omega acids, omega oils like fish oils. They are of doubtful value, but definitely I would recommend that 3 months a year you should take them, because they increase they definitely to some extent they do benefit your dryness. Then you should not smoke. If you are a chain smoker or a heavy smoker, then smoke definitely affects your dryness as well. So these things can actually go a long way in controlling your dryness.
Great, thank you very much. I've got another question here from Ms. Anita, and the question says, what causes your eye to hurt when you blink?
Well, again, there can be a lot of things, but dryness is one of the important things. The other thing could be a corneal abrasion. That means because of the dryness, your cornea has become rough. It is not as smooth as it is. And then there could be glaucoma when you have pain, when you have blinks, or it could be some infection going on in the eye. So there could be a lot of things, but the common thing that we see on an everyday basis would be definitely a dry eye, which is very inflamed.
All right, thank you very much, Doctor. Doctor, I believe an important question, and nowadays a lot of people are wearing contact lenses. So how can a person manage eye dryness related to wearing contact lenses?
Yes, that's a good question, because a lot of young people are using contact lenses. Yeah. So the first, and there are a few tips I would like to give, because what contact lenses does is it acts as a barrier. So it basically coats the cornea, and so the normal tears cannot, kind of lubricate the eye as good as they should, because there's a physical barrier. So it's normal to have dryness in contact lenses, but there are a few tips I can give you to minimize the dryness. One is to use preservative-free teardrops. So they are specialized, so they can be used over contact lenses. So they should be used frequently, at least 3 to 4 times a day. The other is you should use hydrogel silicone lenses or scleral lenses. So they are specialized lenses or soft lenses. So first of all, soft lenses will help you. The second is the material. The material would be silicone hydrogel lenses. They are more beneficial. Then scleral lenses, they are larger lenses, so they have more liberal, surface area ratio there. And the fourth would be to basically blink your eyes more. Blink your eyes more when you are using contact lenses. So that would be another tip for this. And also, I would like in the end that you should use daily wear contact lenses rather than using your extended wear contact lenses. So these things can help.
Perfect. Thank you so very much, Doctor. I'm sure that was a really explained answer. I've got another question here from Miss Alia Adi, and she's saying, "Hi, I have teary eyes always, but I'm wearing eyeglasses already. What is the reason of my always teary eyes in my left eyes? I thought it will heal of wearing eyeglasses, but I think it became worse." So she has a teary eyes. Because of that, she's wearing glasses, but on the left eye is more of a problem, and still the issue is not resolved after wearing the eyeglasses.
Okay. So first of all, tearing has nothing to do with the eyeglasses. So tearing might not necessarily be resolved with the glasses, because tearing could be due to lots of things. Commonly, it could be a dry eye. Now, how dry eye? Some people might ask, well, I have a dry eye, how can I have tearing? Now what happens is that in dry eyes, when the tears are less, so there is a signal, autoregulation, that means the nervous system, our brain sends signals to the gland which manufactures tears to manufacture more tears. But as I said, the tears are not of good quality. So when they cannot coat the eye well, there is a lack of lubrication between the eyelids and the eye. And that leads to pain fibers being elicited. And that when the pain fibers are stimulated, they lead to pain, irritation, and foreign body grittiness. So there's a whole cycle. So this could very well be because of dryness. And one very important cause is there could be some obstruction in your lacrimal drainage system. So there's a lacrimal system drainage. The lacrimal gland is situated here. Through small ducts, it empties through the small hole and through the throat. So there's a whole drainage channel from starting from the corner of the eye up to the nose and the throat. So there could be possibly a blockage there. So you should definitely consult a doctor and see if there's any blockage. It needs to be ruled out as well.
Perfect. Thank you very much, doctor. Okay, moving on towards another question that I have here is, doctor, what factors worsens symptoms of dry eye?
Yes, so the environmental factors, physical factors are very important. Like for example, in Dubai, we are staying all the time in the air conditioned environment. So air conditioning environment is a very big problem of dry eyes because there's a lot of circulation of the air, and whatever the air is dehumidified. So much of the humidification has been taken away, and whatever dry air is there, it irritates our eyes. So there's no humidity in the atmosphere. So one is this. The other is using too much of screens that we already discussed. So when you're using too much of screens, what I suggest is blinking your eyes often. So you should blink 20 times at least in 1 minute. You should blink your eyes and use some lubricants. The other thing is aging. The most important thing is aging. As we age, our lacrimal system, the gland, which produces tears, become inefficient, just like our body. So this is aging. Then especially it is more prominent in females after menopause. So after the estrogen hormone is lessened in the females after 40 years, so this can happen. So these are the atmospheric changes. Too much smoke, too much windy conditions, too much hot conditions. This cannot lead to dryness worsening.
Thank you. I've got a question here from Miss Tina, and she's saying, how do I know if my child's excessive blinking is due to dry eyes or a nerve issue?
Okay. Well, excessive blinking in children, we have to rule out few things. One is the dryness, especially relevant nowadays because, as I said, most of the children are in front of gadgets. So we are seeing lots of children who have this dryness issue. The second is if your child has some dandruff issue, that has to be resolved as well because dandruff is present in the eyelashes and it is very irritating to the eye. The third is you have to rule out if the child's eyesight is weak because many a times a child this is the warning sign a child gives. He cannot see well, he cannot express, so he tries to blink his eyes often to try to see well. So these are the three things, and the fourth and the important I would like to add is sometimes the child develops a habit. We call them tics. So these go on their own, but these are the 3-4. So better if your child is blinking, definitely I would advise you to take him to an ophthalmologist.
All right, great. I'm sure we answered this question. Doctor, moving on towards another question that I have here is actually, what happens if a dry eye is not treated? Looking towards the worst side of it.
Yeah, if the dry eye is not treated, it will worsen with age because it doesn't get treated on its own for sure. So even if you change unless you change a country, like for example, if you're staying in the UAE and you change the country and go to a coastal area, there's lots of humidity, the things are not going to change. So as I said, if the dry eye worsens, what you can have, one is the increased discomfort. Then there is your sensitivity to light. So as soon as the lights are switched on in your house or bright lights are there in the malls, you are just not able to open your eyes and you feel extremely uncomfortable. The third is what happens is that the cornea gets affected. That there are some dry spots, some rough spots develop on the cornea, which can disrupt your vision as well. And in the longer run, they are not very good. So they might cause long-term visual problems as well.
All right, thank you, doctor. Doctor, a few of the times it happens to a few people. Why does it feel like I have something in my eye, like a foreign body or something, but there is nothing?
Yes, so that we had discussed a part of it. So it's basically grittiness. We call it a foreign body sensations. That is because of insufficient lubrication. Because what happens is that the tears, they lubricate all the eye surfaces from the surface as well inside of the eyelids and all. So when there is insufficient lubrication to the eyelids, So it rubs again. It's just like, when there's insufficient grease in your engine. So when there's insufficient, it rubs again, there's friction. So whenever there's friction, it leads to a symptom of grittiness and a foreign body sensation. So just compare it to grease in an engine.
Perfect, thank you. Doctor, what's the role of gels, ointments, and artificial tears?
Yes. So the mainstay of treatment in dry eyes is basically lubricants. So the lubricants can come in drops, they can come in gels or ointments. Now gels and ointments are based in the oil. So that means they are designed to stay longer. So gels tend to stay longer, there is a little bit of disadvantage that they might cause a transient blurring in the vision for a few minutes. So after you put them, if you're driving, for example, you should not drive when you just put them. So about 2 minutes you should wait, and then but the effect is longer. So that is the logic. Otherwise, the drops are good enough. But if you want to put less frequency, then gels will be better option.
Okay, great. Thank you, doctor. Uh, Doctor, normally, what are the treatments that are available for dry eye? You talk about if we can take care of it at home or if coming to the doctor.
Yes. So this is a good question for the general patients to know. There are some symptoms which you can take care at homes. That is home remedies. Like the first I told you, the lifestyle changes, the dietary things, keep yourself hydrated, take a good diet. Apart from that, you can use some humidifiers. So if you keep humidifiers at home, which can humidify the air, that can take a lot of problem, that can cure a lot of problems, especially if you are diagnosed to have severe dry eye. That really helps. So keep humidifiers at home all the time, especially, and keep your fans and ACs at low speeds. So if the circulation is more, the dryness is more. Now coming to the doctor-based treatment. As I said, the lubricants are the mainstay of the treatment. So if you see, now depending upon the severity, your doctor might advise them from 3 times to every 1 hour, depending upon, right? And they help to go a lot. They maintain a long term treatment. The dry eyes cannot be cured, unfortunately. They can be treated. So as long as you put the eye drops, you are fine. But the moment you stop them, so again you might have the symptoms. So people who do not, the next category in patients in which people do not improve with the normal eye drops, or they have to put eye drops every 1 hour, which is very impractical for most of the people. So they don't like putting it. So we advise them something which is called plugs, punctal plugs. Now punctal plugs are small silicone plugs, as the name suggests, about 0.5 millimeters in diameter, which can be put in the holes outside your eyelids, in the holes here. They're very tiny holes, and it's a painless process, just takes 1 minute, and it's reversible. So if your doctor ever asks you that you need a plug, you should not hesitate, because it's a reversible process. In case it causes you irritation or any minor problem, because there are no major problem, it can be taken out just as you put it. It takes 1 minute to put, it takes half a minute to take it out. So it's a reversible process. So the punctal plugs are the next option. The third is, if your dryness becomes even more severe and you have very high level of dryness, then we put autologous serum drops. That means drops which are made of your own blood. So this is used in some extreme conditions, but some doctors still recommend it, and the uses are very nice. The results are pretty nice. In the extreme cases where there are burns or you have drug reactions, which then some membrane transplants can be done in the eye, but they are very rare cases. So most of the patients need not know it. What you need to know is just that eye drops and plugs.
Perfect. Thank you very much, Doctor. Doctor, just in bringing out a case to you, a person sometimes, if you see people who have gray eyes at the border of their lens, actually, is it because of the dryness of the eyes?
No. We call it arcus senilis or arcus juvenilis. So this is basically what happens is that many people can just have them. It's a kind of degeneration. But 50% of the patients can have high cholesterol levels. So in case you have it, you should just get your cholesterol levels, and if they are normal, just take it because there's no treatment for them and they do not cause you any harm except a bit of cosmetic costs.
Okay, so that means it's not taking you towards the blindness
No, no,
as the grade
absolutely,
increases.
absolutely not.
Okay, great, great. Thank you very much, doctor. Another question here, doctor. Is it true that dry eye symptoms seem to be more severe in the winter than in the warmer spring or summer months?
Wherever there is dryness, so like in winters, there's extreme dryness. If you see, there's no humidity in winters normally. So yes, so the that's true because in the like now there is humidity in the air outside if you see. So still your eyes are partially protected. But if you have chilly, windy conditions, yes, the dryness could be more severe. It's true.
Okay, so so that means, doctor, people who are living in the cold countries, they'll have this issue more.
Cold, yes, chilly and cold condition, yes, they will have. Where there's no snow, like cold, chilly conditions.
Absolutely. Doctor, when should a person come in to see their ophthalmologist for dry eye symptoms, and when is it enough to take care of this problem yourself?
Well, I think there are two practical aspects for this. One would be that if you are using computers for more than 6 to 8 hours a day in your job, then I think it makes a good sensible idea that you can buy over-the-counter good standard branded lubricant eye drops and use it 2 3 times a day. Keep on using it without. But if your symptoms still persist, that means the what I said, the foreign body sensation, burning, blurring, so then you should definitely pay a visit to the ophthalmologist. But most of the people, if you can self-treat at home and it's very safe.
Perfect. Doctor, I have a question that is actually opposite to what we're discussing. Guys, I've got a friend here in whose eyes are frequently overly watery. That isn't a dry eye, is it?
Yes, so now this was partially answered in one of our questions. So this is very many times when I diagnose the patients to have dry eyes, they say, doctor, but I have so much watering in my eyes. How can I have a dry eye? So that I told you what happens is that as soon as I'll repeat the explanation here since you've asked a question, the patient has asked. What happens is as soon as there is less tears made, a signal is sent by our brain to the gland which is manufacturing tears that it has to secrete more. So it starts secreting more, but the quality of the tears is poor or maybe inadequate still. That means it does not have the right mix of oil, mucus, and water. And patient still feels dry and it is not adequate enough to kind of coat the globe. Then what happens is when there is lack of lubrication and the eyelid is consistently rubbing over the cornea, there are hundreds of nerve endings. The cornea is a very sensitive organ. So it's just like when something goes inside our eye, we start watering. If you see, so it's the same. So when there's irritation, the eyes start watering. So it is a reflex tearing. It's not a routine tearing. It's a reflex tearing to something irritant in the eye. So that's why the eye it's ironical that dry eyes people can have watery eyes as well.
Okay, okay. Uh, Doctor, are some people more prone to having dry eyes than others?
Yes, definitely. Now here it is pertinent to mention that the main causes of dry eyes are basically, as I said, aging, the lifestyle changes. I'm saying in order of what we see. Females, especially after the menopause, then then there are very many diseases that you have like rheumatoid arthritis, or diabetes, hypothyroid. So all this make the eyes more prone to have dryness. Why? Because all these diseases cause inflammation and damage to the gland which secretes tears. Then very important is the patient who have undergone surgeries, especially LASIK. So LASIK patients frequently end up having dry eyes. So these patients, now these are the common things that we are seeing on an everyday basis. So So all these, then medications also. There are few medications which can cause dryness, especially the anti-allergics, the antidepressives, the medicine we take for blood pressure, the eye drops we take for glaucoma. All this can cause dryness in the eyes.
Perfect. Thank you so very much, doctor. You've really given a lot of information related to dry eyes, and I'm sure this information was very much useful to everyone out there. Doctor, before we end up the live session, I would really like to ask you one last question, which will be a kind of take-home message also. Doctor, what do you recommend, or any recommendations for people to help them avoid dry eye issues?
Yes, now this is a very pertinent question. And so one thing is very important is first to be aware that practically everybody can have dry eyes, including the kids. So the children as young as 7, 8, 10 years are having dry eyes nowadays, as per our experience. So that's first is awareness. So once you're aware, then you should start the treatment. So the first treatment is self-awareness and self-treatment in the form of home maneuvers that you can do. Like if you feel like using humidifiers, not gazing at the screens for a long time. You're restricting your kids not to use mobiles and all the screens more than 3 to 4 hours a day in whatever forms. Then using eye lubricants, as I told you. Then even when you are using computers, I would like to suggest few modifications. One is that your computer should be little 4 to 5 inches below your eye levels. So little below. Why? Because if your computer screen is above your eye levels, what it does the surface area exposed increases and there is more evaporation of tears. So that is very important tip. So little 4 to 5 inches you should be looking down, and most of the people do find it more comfortable to look down rather than look up. So this is another tip I would like to give them, that they should use lubricant, and at least once a year visit your ophthalmologist. Any symptom should not be taken very lightly.
Perfect. Thank you very much, Dr. Sumeet, for the all information that you've given related to dry eyes. It was very informative, and it is going to be helpful for people who are watching at this time and people who will be watching after the live session, for sure. If you have just before I end up, I really wanted to tell that we received a lot of appreciation from people related to the topic. That a lot of good information was given. So thank you everyone for watching us and appreciating the doctor for giving such a wonderful information. Doctor. Thank you so much. I would like to tell all our audience that if you are looking for consultation with our Dr. Sumeet, who is currently practicing in Prime Medical Center, Alnahda branch in Sharjah, you're more than welcome to book an appointment through our application that is mentioned at the bottom of your screen. You can see Prime Health Me, and down you can book an appointment as per the schedule of the doctor, or you can always book an appointment by calling our helpline if you don't have a internet 04707009, and you will be booked by our call center agent. For any feedbacks, please do write us at myprime@primehealth.ae. One important thing we would like to tell you is that it will be a pleasure for us that if you put your recommendations to our Facebook page, give us a feedback, or any review that you would like to give us on Google, we'll be more than happy to receive. So thank you very much, everyone. We will be coming back to you with another live session very soon on another important topic very soon. As Prime always says, Prime is all about personalized care personally. Thank you very much, everyone.
One last information I would like to give
please,
is that we are doing all the procedures here. We are doing the plugs, punctal plugs. We are doing it here, and we have the sophisticated exams for the dryness or the test. We also have at our clinic here. So if you have any kind of problem, you can come for a second opinion as well. And there are some latest drops that have come in the market. So we use them, and we have in the pharmacy, so we can always do the best for you. Thank you so much.
That's great, doctor. Thank you so very much. As doctor said, the whole treatment is available related to the topic that we have done today. And of course, as I was about to say, and I will be saying it now, that Prime is all about personalized care personally. That is what we always deliver. So thank you very much for watching us. We'll be coming back to you with another live. Take care. Bye-bye.